Hello, everyone. Welcome to another episode of the Driscoll Decoded. I am Angela, and I am your host for this lovely podcast. Today, I'm really excited to bring on our next guest. You've seen him on our social media through videos, through health facts, and everything in between. He is one of the first executive leaders that I actually recorded once I got here. So I'm super excited for him to be one of the first executive leaders on the podcast. So everyone, welcome Dr. Serrao.
Hi, everybody. How y'all doing?
Great. Thank you, Dr. Serrao, for agreeing to this.
Oh, no problem. Love it.
You're such a joy on camera, and you're such a joy to work with. It's easy. It's easy with you.
Thank you.
Yeah, so Dr. Karl Serrao, you are the Chief Medical Director.
Chief Medical Officer. For the health plan, yes.
Yes. So just tell me, what inspired you to be a doctor?
Wow. Now you're taking me back.
Way back.
Way back.
Way back when?
I will tell you, really and truly, it was my brother.
Okay.
So my brother, Peter, he was much older than me, and he went off to medical school. And when he would come back home, he would bring a stethoscope, and I'd steal his stethoscope and go listen to the dog, and he'd get upset with me because I put the stethoscope on the dog.
That's so funny.
But he kind of opened up my that world. He was also a great mentor to me throughout my career. But he kind of introduced me to that whole world. I was always interested in biology. I loved anything I could get my hands on that talked about living organisms and how they work, and so to me he kind of showed me a path, and so that's kind of how I got interested in medicine. But
Nice.
I loved anything that had to do with biology and living things, and so it was that's how I got into it.
What kind of doctor is he, or was he specialized?
He was a neonatologist, and so he used to take care of preemie babies. That's how people think of neonatologists. But yes, he took care of those little preemies.
Oh, and you are a pediatric.
I'm a pediatric ICU doc, correct.
Nice. So what made you specialize? Because I hear pediatrics is one of the hardest, actually, to get.
Oh, I don't know. Some people think pediatricians are like human veterinarians, right? Say, oh my gosh, kids don't talk, So in some ways it is like that, but it's also, to me, I can always tell when children are sick. And very often, yes, we do rely on their families to help us, tell us more about what's going on. But I also see, kids also are very resilient, and they bounce back, and so to me, that it's great pleasure to see that, and children are our future, and so to me, that's the parts I love about pediatrics. And then, of course, I do pediatric ICU medicine, and most people don't know what that is.
Yeah, please explain.
I'm a doctor with machines. That's how I always tell people. I take care of the sickest kids that are in the hospital. They're not preemies, because remember in neonatology, physicians take care of those preemies.
Yeah.
But they can be babies, and they could be adults, and they tend to be the sickest kids. They may have had surgery. They could have been involved in trauma, or they have bad infections, and so very often we have to manage those kids, and they have lots of problems, lots of organ dysfunction. They require lots of machines, literally, ventilators, pumps, you name it, and so to me, I always love that. It's complicated. So how do you take a complex problem and make it simple? Have to work with a lot of other physicians and teams, and so you get to learn how to manage people, and learn how to recognize that work with teams. So I'm a pediatric intensivist, and like I say, I'm a doctor with machines.
Nice. Love it.
And then people say, well, what do you do? I said, well, I'm really a delivery man. And they
Delivery.
say, well, what do you mean? It says, I deliver oxygen. That's my job. My job is to deliver oxygen. So a very simple way,
Yeah.
but yeah, that's what I do. Well, at least what I trained to do.
Mm-hmm. Because when people think of pediatric doctor, people don't usually think like, oh, well, it's all the way up to 18 as well. So they
Right.
think young
Or older.
kids and older.
Or older.
Okay.
Yeah, because especially if you have kids with complex needs,
Mm-hmm.
you don't find a lot of adult doctors that are willing to take care of them. So it's not uncommon for some pediatricians to be taking care of their kids
Yeah.
when they're adults, because it's hard to find
Wow.
those kind of folks. And
Yeah.
although when the kids become teenagers, says, why do I've got to go to the pediatrician? It's just like, we still know a few things.
Definitely. So it just shows right there that pediatric doctors have a lot of heart.
Absolutely. Absolutely. And you can tell when we've come long in the tooth when you start taking care of the grandchildren.
That's awesome.
Or the grandchildren are bringing their kids.
Yes.
That's like, I've been doing this for a while.
Yes. So I have a daughter,
Mm-hmm.
and she is 3 years old, and my doctor is Dr. Patel,
Mm-hmm.
and my family has their own children too. So the fact that like he took care of all of us when we were babies, and then now he's taking care of
Right.
their kids,
Right.
and it's just really cool because it's so comforting too.
Yeah. And there's another thing nice about pediatrician. You do end up seeing generations.
Mm-hmm.
And so to me, that's why it's so great, because you make an impact not just in somebody's life today, but you make an impact in future generations.
Exactly.
Yeah.
Are you still practicing?
I still do, not as much as I used to.
Mm-hmm.
I do. I work in the ICU several nights a month.
Oh,
Yes.
okay.
I still do that.
Nice. How many years of school did you have to get to?
Oh, too many. No, I think altogether it was about 13 years.
Okay. Oh, wow. Wait, after?
So if you look at school, so I went into medical school straight out of secondary school,
Okay.
which is not typical in the United States.
Mm.
And so in the United States, most people will do an undergraduate degree.
Mm-hmm.
So that's about 4 years. And then
Yeah.
if they get into medical school, that's
Yeah.
another 4 years.
Yeah.
And then you have to do, once you graduate medical school, you can't just go out and practice. We have to go do a residency, which is kind of a very fancy word for an apprenticeship
Mm-hmm.
in the specialty in which you want to do. And so that could be 3 years, that could be longer,
Mm-hmm.
could be up to 7.
Wow.
And then if you want to become a subspecialist,
Mm.
meaning you want to subspecialize in your area. So I did pediatrics, and then I became an ICU doc, so I became a subspecialist. You can adds on another set of years. So, so you add it up, and so yeah, it's about that.
So we are talking to an expert for sure.
Well, that's so kind of you to say those things.
You went to school, and you became where you are now as chief medical officer.
Right.
What led you to kind of like not steer away, but like choose a more leadership role rather than continue just doing practicing medicine?
I love what I do in taking care of patients. But I recognize after taking care of patients for a long time, I recognize, there's probably a lot more that I felt that I could do than I was doing. And that meant taking care of more than just one patient at a time.
Yeah.
So when I was given this opportunity to join the health plan, I kind of viewed it as that kind of opportunity, an opportunity where it wasn't just taking care of one patient at a time.
Yeah.
It was taking care of help make sure that thousands of children got the right kind of care.
I love that.
And very often when you find to affect change, sometimes you have to do things that nobody sees, right? Nobody sees what we do, really. But you walk away with the satisfaction that you're making a difference in many, many lives. And so it was about that. And another part was I love leading teams. I love when we would have team meetings and you saw change happening and you saw people working together. And so, that's what leadership is.
Yeah.
And so to me, that was increasingly enjoyed those aspects of medicine. So that's how I ended up kind of stepping into this role.
That's amazing because on our last episode with Victoria, we all kind of agreed that everyone that works here at DHP, we have a sense into making a big difference in people's lives that we don't even really see, and then they don't see us either. But we all have one goal in mind, is to make children better.
Right.
And make families better. And so what you just said just like lined up without even knowing.
Yeah, I mean, at the end of the day, I think people, medicine is a profession. For some people, it's a calling. But I think whether you're taking care of patients one at a time at the bedside or in the office, or whether you're here in an organization like the Health Plan, really and truly, part of our mission and goal is to make people's lives better. And I think if you can give someone their health, you can make their lives, their quality of life so much better. And it's not just living longer.
Yeah.
It means they can become more productive in whatever they choose to do. They're there to raise their families. I mean, so what people say is, always say, as long as I have my health, I'm good. And so to me, it's about how can we give people their health? How can we help them sustain their health?
Exactly.
Is really, really our mission.
Yes, agreed. So being an expert in your field and knowing all that you know about the human body and wellness, do you have any health habits or quirky little stuff that you do to keep yourself healthy?
Yeah, I don't do them enough.
Okay, great. So
you know what they say, the cobbler's children have no shoes. No, I'm just teasing. So, no, I think number one, I think my wife is the one that actually is my number one thing that keeps me healthy, because she is very health conscious, and so eating well is number one. I'm like everybody else. I love all the things that are bad for me, but eating healthy is good. Recognizing that eating healthy doesn't mean to say that you don't enjoy lovely, tasty stuff.
Yeah.
So, but it's about eating healthy. It's how much you eat, making sure you have a balanced diet. So number two is I love being outdoors if I can be outdoors. And so I love, I like cycling. And to me, that's a good place to be outdoors. You're doing something healthy with exercise, but it also means I get to socialize with the folks that I ride with. And so, so to me, that is kind of maybe one of the few things I've been able to do. But I do encourage folks to get outdoors. I think there's something about natural light and appreciating nature, and you don't got to be doing fancy stuff.
Yeah.
But
getting out of the house, if anything.
Yeah, I think too often we're stuck. We're in the house. We're and I think we need to get outdoors.
Yeah, agreed. So you said you do cycling. So you're part of like a group?
Yeah, I'm actually part of several groups.
Oh.
So it depends. Well, it depends.
Nice.
Sometimes I'm in a mood. I want to talk to these kind of folks. And sometimes they want to do this kind of ride. And, so yeah. So
what else do you do?
What else do I do?
Yeah, outside of work, outside of practice medicine, what else do you do?
I work too much. Oh, no, I'm just teasing. No, I do work too much. So what do I do? Well, to me, I would tell you, so cycling is one part, but it's also part of my socialization. I love going out to eat.
Favorite restaurant?
My favorite restaurant?
Yes.
Oh. What, in town or in general?
Yes, in Corpus. Your go-to.
That's a hard one. I think the yardarm.
Okay. Nice.
So I'm giving a plug to the yardarm. There you go. So
There you go.
But it depends upon my mood. Love the hole in the joints too. I love Z Counter. Love Asian
Yes.
food. Oh, I love Asian
Oh,
food.
yes.
I really do love Asian food.
Nice. Are you a sushi fan?
I do love sushi. Dokyo is one of my
Yes.
places in town. I love their beef don. It's good.
Have you been to Umiya or Umaya?
Umaya, I have.
Yeah.
I have.
Do you like it?
It's okay.
Oh. It's my favorite.
And yeah. So, but I'm part. I'm part Chinese, so I love my Asian food.
Oh, I didn't know that.
Yeah, my grandfather was Chinese.
Wow.
Originally, I was born and grew up on an island called Twin Islands of the Republic of Trinidad and Tobago in the Caribbean.
Oh, wow.
So that's where I'm originally from.
Ooh.
That's where I went to school.
Okay.
And
okay.
so yeah.
So when did you move?
Oh, about 30 years ago.
30 years.
I came up to the United States to do my training in pediatrics.
Okay.
In my residency, and I did it at Driscoll right here in Corpus.
Oh. Do you miss home? Do you miss like?
Well, I will tell you what my wife says. You are living home. By the way, she tells me this, and she's right. This is my home.
Yes.
So my place of birth, yes, I
Yes.
do miss it. There is something, from Trinidad and Tobago, we call ourselves Trinis, and Trinis have perfected how to have a good time or party or hanging out, which in Trinidad we call liming. So right, liming. So liming is like hanging out.
We're liming.
So we're kind of like we're kind of liming, but we need to have adult beverages if we're liming. So
This is water.
and Trinidad and Tobago has its vibe, and I think it's one that cannot be. It's very difficult to replicate. There are very few places in the world I've been that can replicate that vibe.
Oh wow.
And that's what I miss. I miss that vibe.
Yeah.
It has an energy. It has a way of they've perfected the way of doing nothing, and having a good time doing it.
Wow.
And the carnival is fantastic. The carnival is fantastic. The music is great. The food, the culture. It's a very mixed, diverse culture. And like I told you before, I'm part Chinese. My grandfather was Chinese. He was an immigrant to Trinidad.
Wow.
Serrao is a Portuguese name, and so my other grandfather came from Portugal. My grandmother's one of my paternal grandmothers from Venezuela.
Have you ever done an ancestry?
Yes, and so part of, so if you think about it, I would be considered second in Trinidad. I would be considered second generation. Everybody was an immigrant.
Yeah.
And so I come from this very mixed background, and then now I'm an immigrant to this country, and so my kids are first generation immigrants. So, so there is a lot of that boiling that cultural mixing pot. So that is I may not look that way on the outside, but I tell people you do not know what their cultural backgrounds from just looking at them from the outside.
Exactly. That's super cool.
Until you talk to them and you realize that we have sometimes a lot more diverse cultural backgrounds at how it shapes us and how we look at the world. And so
I did. My husband got me an ancestry little kit, and I finally did it. We sent it in because I'm always getting comments about, or compliments, I don't know how people mean it, that I look like an Asian Hispanic. And that's all my family's ever heard, like when people will talk to them. And so I'm like, we don't really know where we're from, because my dad was a foster kid.
Mm.
So I'm really excited for those results. How long did it take for it?
Oh, you haven't gotten it back yet?
No.
Oh, okay.
I just
Okay.
sent it in, and I'm waiting. And I'm looking at the app every day. But I will let you know what my results are.
Well, yeah, my father, if you saw my father, he's since then um, passed away, but, when he would visit here, people would take him to be Hispanic, and he would say, you know, I'm not.
Yeah, yeah.
What part of me looks,
Mm-hmm.
not understanding. Because he's very olive skinned, and I used to be a lot more olive skinned until I came here, and there's no light. But yeah, so the answer is yes. Like I say, you cannot look at folks from the outside and really
Know
and
someone.
make judgments.
Yeah, agreed. I feel like I know you so much more now.
There you go.
I love this. So kind of taking a turn here. So you mentioned earlier about when you were going to school, there's like residency and everything like that. My favorite show is Grey's Anatomy. I know throughout the years, because it's been on since 2005, maybe.
Mm-hmm.
Throughout the years, everyone has their opinions about it. And so do I, and so did I. But now I have caught up to this latest season, season 13, maybe 14. Have you watched Grey's Anatomy?
Well, I've not watched Grey's Anatomy lately, but yes, that's when I remember when Grey's Anatomy first came out, and I used to watch it quite avidly for many, many seasons. Yes.
What was your favorite? Who was your favorite?
Who's my favorite?
Yeah, if you can recall.
Well, she's no longer on Grey's Anatomy, and I'm gonna start showing my age, and that was
Dr. Yang.
Dr. Yang.
Yes.
What's the actress name? Is
Sandra Oh.
Sandra Oh. I love Sandra Oh. She's fabulous. I love Sandra Oh. She's also in that series Killing Eve. Oh my God, love that series. So
she's great.
But no, Sandra Oh. So yeah, Dr. Yang, loved Dr. Yang.
Who can you relate more to?
Yeah, Dr. Yang. Oh yeah, Dr. Yang.
That's awesome. So Grey's Anatomy and all the characters, the different doctors.
Right.
How do you think the media portrayed these doctors, and how do you think that affects the viewer of how cardiothoracic doctors could be, how pediatric doctors could be?
Well, it's a good question. So I think the positive aspects of it is it shows that at the end of the day, doctors are humans. Doctors are people. So physicians, even though you're very much about providing service, you're human, and we could all be having a bad day, right? The other thing I think the show sometimes, I think at least Grey's Anatomy often shows, I think is relatively accurate, is, the training is tough, and they work a lot of long hours, and those things can wear you down, and those things do impact how well sometimes, or maybe not so well, we interact with patients and families. So I think in those aspects, I think it's good. Of course, like all these shows, it's about entertainment.
Yeah.
Right. And so you must have some drama. But and then all of a sudden you have all these different doctors that's like, well, aren't you supposed to be doing?
That's not right.
Yeah, that's you. What are you doing there? Why are you there?
That's not the right word.
It's just like, you have this very limited cast, and so you have to have them doing all these things. So I'm like, so in that aspect, and sometimes the medicine is like, it's like
a little off.
Well, it's not so much as off. It's just like, oh my God, it's happening that fast, that quickly. Or things
so
don't
it doesn't happen that fast?
Things don't always happen as quickly as they make it out to be. Well, you only have an hour to have a show, right? So
very true.
So you got to make it look fast, and and sometimes sometimes they kind of over dramatize the relationship pieces. You know, I think you know if you if you watch the show, you think we're all sleeping with each other. So I don't think that's necessarily accurate either.
Yeah.
I think for the most part, most physicians are very professional.
So the first episode showed, like interns, you know, they're the bottom, they're the scut, and they had to work like that 48-hour
Right.
shift. Is that accurate, or like have you seen something like that happen?
I mean, I think. Oh yes. I mean, I go back to my own training. I mean, things have gotten better for training.
Okay.
Things have gotten a lot better for training in terms of how many hours you can work. But yes, when you first start, that's people don't understand that that's
real.
That can be real. Yeah.
Wow. You know, there's like there's interns, residents, attendees, and attendings. Is that how like it usually? Oh, and then like the chief of surgery.
So it can be it can be hierarchical. Actually, you didn't mention the medical students. So the medical students are really they're really the bottom now. So you have the medical students. You've got an intern is usually a resident. An intern usually means somebody who's in their first year of training after medical school.
Okay.
And then a resident is they're basically they're physicians. They finished medical school, they've gone to medical school, they're doctors, but they've not completed their training.
Okay.
And so like if you're into pediatrics, you're going to be a resident or surgery, right? And then once you finish your residency, and then they have actually fellows. Fellows do subspecialty training. Then once you finish that, then you can be licensed and practice as an attending, right? It was typically, and then then people that get into leadership roles.
Yeah.
You know, you could have.
You were chief of staff, right?
I was chief of staff at Driscoll many years ago. You know, so as chief of staff in a hospital, it's really about you're looking at the entire medical staff.
Okay.
Right, and in terms of making sure that we are bringing on the right types of medical staff, making sure that we're maintaining particular standards of quality of care and behavior. You know, when you get into those division chief positions, like what you're talking about in Grey's Anatomy, like the chief of surgery, you know, they serve very much a leadership role. And so their leadership role is, again, very much the same thing. You know, are your teams working effectively? Are they communicating well? They may have, if you have got a training program like a residency program, they're going to be probably looking at, is your training program doing all the things they're supposed to be doing? Are people following the rules? Are people following protocols? You know, those kind of things. So very much a very leadership. And then how does that department work well with other departments?
Gotcha.
Right? And so, so communication. So once you get into leadership roles, communication is probably one of the key things that you got to be good at.
Yeah. I mean, organizational communication is everything. Organization communication is everything in a leadership role. What are some of the things that you do here at Driscoll Health Plan?
Oh my gosh, that's such a hard question to answer. I do everything. You know, people meet me and they say, "What do you do? What does a doctor do at health insurance?" It's just like, I start talking to them and the eyes just glaze. I talk to my wife and she's just like, "I still don't know what you do."
Okay, let's break it down.
I'm playing. You know, at the end of the day, people are surprised to find out that so many of the people that work at the health plan are doctors and nurses and medical people. Because, you know, they look at doctors and nurses and says, "Oh, you're taking care of patients." Yeah. So what are you doing in insurance? Right? They look at us as, "Oh, you're," you know, and I would tell you, "Hey, we're here to make sure." This is what I tell people. My job is to make sure that the people that take care of you have the tools that they need to do it.
There you go.
Right? And when it comes to the patient, that they have the resources they need to maintain their health. So bottom line, that's my job. My job is to make sure that as a Medicaid health insurance plan, that the doctors have the tools they need to do the right things,
Exactly.
so they can deliver the
Yeah.
care. And as a health plan, we want to make sure that our clients, our members, who are the patients, or who can be the patients, have the resources to maintain their health.
Yeah.
Right?
Yeah.
And so that's ultimately. So remember, I said as an ICU doc, what's my job? I'm a oxygen delivery man. So my job over here is to make sure that our teams are working well, to make sure that your doctor is has the tools to do what they need to do to take care of you.
And that's amazing, because it's like, who wouldn't be a better fit than an actual, expert and an actual doctor in the field to relay these messages, to know what strategies that need to be in place for our overall health. And so I really like that we have, nurses, doctors, just medical experts overall on Driscoll Health Plan team.
Right.
Because it is the most accurate health, like compared to someone who's never practiced medicine before.
Right.
And so you're just getting different perspectives and deeper perspectives, and knowing better of what our patients and our members need.
Well, it's not just being an expert. It's also being part of the community. And so I would tell you, so even though I'm not I'm an immigrant myself, like I told you, I've spent more than half my lifetime living in this community. And so to me, this is home. And so I'm invested in this community. I'm part of the medical community as well. And so too are the nurses and the doctors that work here, are part of this community. And so for us to do a good job, it's not just being an expert.
Yeah.
But it's also getting involved and having some skin in the game, being part of the community and understanding what the community needs, because that's the best way we can give you the best care.
Exactly. That's amazing. So we're gonna switch gears here and talk about the most somewhat recent health topic that popped up almost now 4 years ago. COVID. I know, as someone who doesn't know anything about medicine or anything like that, it was a scary topic.
Right.
Because there's the only people that we had instant messages from was from the media.
Right.
And so I would love to dig into what you thought with your expertise, what your viewpoints were on it. Whenever you first started hearing that on the other side of the world that it was happening, what were your thoughts about what this could be, or it was just another something that was happening where we couldn't see?
Well, I I think I'm like everybody else. When it first came out, we weren't really kind of sure what to expect, but I think we quickly realized that what we were dealing here was the beginnings of a pandemic. Now, I would tell you, in my many years in medicine, one of the greatest fears I've always had in dealing with would be us having to deal with a pandemic. We did deal with one in the early 2000s with H1N1 flu. And then we had a couple little flares when we had SARS. And so my biggest fear was, because this was a coronavirus, came out of the SARS type of viruses, I was afraid that it was going to be super lethal. And it was going to spread quickly.
Yeah, which it did.
Thank goodness it wasn't as lethal as the original SARS, but it was pretty lethal. And so to me, it was probably one of the scariest moments. And I think for many people, it's going to be it was a life-determining point in time. It's a watershed moment in time in terms of how it changed our lives. And I think it has.
Yeah.
And so,
How did you and your family prepare, it got into the United States, and then it got into Texas, and then by the time you know it, it got into Nueces County. How did you and your family prepare to handle home life and y'all's health, and then
Right.
you back practicing medicine, but also you were here at DHP?
Oh yeah. So a lot of people end up going. Kids went to school from home,
Yeah.
remote, right? And so
Mhm.
that affected the family directly. My kids had to take school from home, and I think kids got affected. I think mine as well got affected from not having that socialization,
Mhm.
and but my children handled it differently. Some we did work from home for some degree,
Mhm.
but I never really stopped working in the office, or actually also working in the hospital.
Yeah. Yeah.
So I think that was very scary for my family to know that I was still having to work in the hospital.
Mhm.
And I think very very much like how you saw, you know, me, having to mask up,
Mhm.
and you just didn't see family.
Yeah.
You didn't have the socialization
Mhm.
happening. I think those parts were tough.
Yeah, definitely. I was, let's see, I was about 8 months pregnant whenever March 2020 came around. And I was working in a medical clinic in Houston. So, and we just moved there too. And what all of a sudden I remember, because I was the front desk person, um, everyone was freaking out. And whenever like someone checks in, you can see like the notes and everything.
Right.
All of a sudden, like these people were traveling from where they're saying like if these people traveled from here or here, it's pretty hectic, especially with hearing that like Houston was going to be like this hot zone that no one can go into. And I just remember I was about to give birth and no idea what was going on, and it was just right before the hospital started only doing not only doing, they were already doing the one person rule, but masking up like
Right.
during
Right.
delivery.
Right.
I just missed that, and yeah, it was such a whirlwind, and it's such a time to think about, and so I can only imagine here, like you have, your family, but also not just 1, 2 patients. I bet y'all saw an increase in the hospitals here.
Oh yeah. So remember we had surges on the hospitals. The hospitals had more patients than they could handle.
Mm-hmm.
Um, unfortunately, we had a lot of patients that were dying. I lost several very good friends, colleagues, and family.
I'm sorry.
But I think that is also a shared thing that we saw, right? You also you also recognize that when you went to work, you weren't just putting your life on the line; you were also putting your family's lives on the line.
Yeah.
But at the end of the day, this is what you signed up for. This is what I tell people. This is what we signed up for in the medical profession.
Mm-hmm.
And I was just glad to see that the medical profession stepped up
Mm-hmm.
and took good care of patients, developed therapies pretty quickly.
Mm-hmm.
I think it was amazing that we established a vaccine within less than a year,
Mm-hmm.
because I think that was a game changer. I think,
Indeed.
and yeah, so but what it also showed was that we're very resilient,
Yeah.
and we can be,
Mm-hmm.
and um, working together as teams. I think we were able to accomplish a lot and do a lot of good things for families.
So I know, there's always going to be misconceptions, misperspectives about vaccines and everything like that. Can you explain in the most like simplest way? Because people say that just like the flu, if anything, like COVID, you get the COVID shot, you get COVID. I remember someone tried to explain to us like the mRNA is not alive.
Mm-hmm.
Or can you explain like how that like happens, where like we are just being protected from the virus?
So the way our immune system works is that it has a memory.
Mm-hmm.
So if you get an infection, if you've had that prior infection before or something similar, it knows how to respond. Your white cells and your antibodies and respond to that infection.
Mm-hmm.
And especially true for viruses.
Mm-hmm.
So, and that's called immunity, right?
Mm-hmm.
So the more you get exposed, the more likely you have that immunity. And that's how vaccines work. Vaccines kind of, we try to you do it safely, where you try to expose the body to some of that material from a virus or bacteria, so the body learns that this is foreign and I need to respond to this.
Okay.
And so if and when you do get that infection, it protects you. Nothing is 100%. I always tell people, no vaccine is 100%. Some vaccines have helped eliminate diseases. So, like for instance, nobody knows. Some people don't even know what smallpox is today, right? We've eliminated smallpox through vaccination. Or polio. I have seen kids with polio.
Wow.
People don't think about it.
Yeah.
It still exists in the world, but nowhere near. Some vaccines don't give you protection to protect you from getting seriously ill. It's like most times the flu vaccine, and the same thing with the COVID vaccine. The best way to say it makes mild, meaning that it may not totally protect you from getting an infection, but it prevents you from getting a severe infection.
Yeah.
And so, for instance, the COVID vaccine did not eliminate you getting the infection, but it definitely made it where people who would otherwise be hospitalized or die did not end up getting hospitalized or dying from it.
Okay.
And so vaccines can work to varying degrees. I've been in medicine long enough to unfortunately see children die from preventable diseases that could be from vaccines: measles, whooping cough, diphtheria, tetanus. I've seen people die from all those conditions. I've seen kids become paralyzed because of polio. I've seen children develop meningitis because of Haemophilus influenza. And we have vaccines today. And it is amazing that I no longer see those things anymore.
Yeah.
But I have that kind of experience. And people not knowing that, having that experience, don't see how much those vaccines protect them. And even during a pandemic, like I said, people said, "Oh, well, the vaccine I still got COVID." Well, yeah, but you didn't die.
Yeah.
And you didn't end up in the hospital. You didn't end up needing oxygen. And what the vaccine did was it made it go from wild to mild. And
like
that is the benefit of those kind of vaccines.
Agreed.
Did I make that easier to understand?
Yes, you definitely broke it down. Yeah, because when anyone starts throwing terms at me, I'm like,
This is why I always tell people, get the flu shot and the COVID shot. It may not protect you against getting the disease. No vaccine protects you 100%, by the way. But it definitely would make it go from wild to mild. And the more of us that get the vaccine, it protects. It's called herd immunity. It protects everybody else. So your colleague and your friend is helping protect you when they get the vaccine. So get the vaccine.
Yes, agreed. Okay. I appreciate you talking about COVID, even though we are post-pandemic.
Right.
But it's something that's still.
It's here to stay.
It's still here. Yeah, it's here to stay, and having these refreshing conversations of just how it affects you and how you can protect you and your family from it. So I really do appreciate that. So we're going to play a quick game of Mythbusters with true or false.
Okay.
And so these are just general statements that people usually say. So just true or false. Alrighty?
Yep.
Okay.
We're ready.
Cold weather causes colds.
False.
¿Por qué?
I think the data shows that it's not really about the weather. What typically happens during cold weather is, what do people do? They stay inside.
Yeah.
And then what happens when we're all inside? We pass our germs to each other. So it's not the cold weather that gets us sick. It's the fact that the cold weather forces us indoors, and we tend to be in much more communal settings, and makes it a lot easier to spread those germs and viruses around.
Gotcha. Cracking knuckles causes arthritis.
No, my sister should be all arthritic by now, and she isn't. And she used to do it. She used to do it to me all the time. She'd come and crack her knuckles, and no, it doesn't.
Okay, good.
It's annoying, but
Good. I'm good then. Children need antibiotics for every illness.
No, definitely not. In fact, that could hurt them.
Okay.
So
what do you suggest?
So most often when we get the cold, it's a virus, right? Now, when we start throwing antibiotics at this, what happens is those little bugs are very smart. They know how to modify their genetics, and so the bacteria that are the normal bacteria that are around change up their genetics, and so they know how to fight. They know how to fight those antibiotics.
Yeah.
So antibiotics only work for bacteria, not for viruses.
Gotcha.
Most colds are viruses.
Gotcha. Bacteria.
And when you give an antibiotic for something that you don't need it, then what you're doing is you're increasing the likelihood of those bacteria that are in a community to become resistant to those antibiotics. So when they do get that severe infection, that antibiotic may not work.
Gotcha.
So, and then antibiotics are drugs, and so they have side effects, right? And so you can get allergic reactions, and you can get some of those side effects. So if you're going to use a drug, make sure you're using it for what's best indicated.
No.
So every time your child gets a cold, an antibiotic will not fix it, make it shorter. If anything, it increases their likelihood that if they ever do get really sick, that antibiotic may not work as well because we've used it too much.
Yeah, I've definitely heard that before. Vaccines causes diseases and sickness.
Absolutely not. So I will always tell people, a vaccine has a side effects. So have that conversation with your doctor about the benefits versus the risks. But vaccines, like I just had this, we just talked about it. I think vaccines have changed. The two things have changed health for human beings. One is public health, clean water, clean food supply. The other part is vaccines.
Okay.
I no longer see childhood vaccines that kill. You gotta remember, it was only a century ago where one out of every 2 children died.
Oh wow.
And most of it was from preventable illnesses.
Yeah.
And today we don't see that.
Yeah.
And that's because we have vaccines. And so I think vaccines, for the most part, are very safe. But they do have side effects. I think you do have to have a conversation. But I strongly do encourage folks to get those vaccinations. Okay. I think it's part of that overall health.
Yes.
Last
one. All fevers are dangerous.
No. Fever is a sign.
Okay.
Right? Fever is a sign that you have an infection, most often. Right? It doesn't necessarily mean that the infection is serious.
Okay.
Again, this is where I do think you need to be looking at other things other than fever. And definitely, don't be afraid to contact their physician if they have questions. And most often that can be a phone call. That doesn't mean to say you got to go to the office. But you should be looking at other things. Hey, how well is your child eating? Are they acting themselves? Most often it's a cold.
Okay.
But no, fever is very often a sign.
That's comforting because as a first-time mom, I was anytime.
Sure. It's
my baby.
Probably most anxious time, right?
Yes.
Oh my gosh, my baby has a fever. What am I going to do? And so one of the first questions the doctor, hey, is your baby eating okay? Are they drinking okay? How active are they? Are they still smiling, cooing?
Yeah.
Right? So if your child's lethargic or they're not eating or drinking, those become much more serious kind of things. And all a fever is telling you that you probably have an infection. Doesn't tell you how severe that infection is usually.
Well, thanks for that game. And thank you, Dr. Serrao, for joining us on our Driscoll Decoded podcast. I hope we decoded a lot for our viewer there in this session. If you haven't already, subscribe to our YouTube channel to view the full video with Dr. Serrao, and to follow our social medias at Driscoll HP. We'll see you again until next time.